People describe healthcare as if it were a market. It isn't. Markets have transparent prices, real choice, competition, and the freedom to walk away. Healthcare has none of that. What we have is a billing architecture wrapped in market language. And you can't fix a system built on the wrong foundation. In this series, I'll walk through that foundation because redesign begins with clarity. Healthcare isn't a market. It's a shell game. RVU Nation, Day 1, Built to Bill. A system built on the wrong foundation cannot be fixed. It must be rebuilt. For decades, Americans have been told that healthcare is a market. Politicians repeat it. Industry leaders insist on it. Economists defend it as though it were axiomatic. Even physicians, exhausted by the contradictions of their own workplace, reach for market language because it gives them a familiar frame for something that defies ordinary explanation. But walk into any exam room, emergency department, operating room, pharmacy, or billing office in the United States, and one truth becomes unavoidable. Healthcare in America is not a market. It has never behaved like one. Markets require transparent prices. Healthcare has none. Markets require real choice. Healthcare offers only fragments of choice, rationed by networks and benefit designs. Markets require competition. Healthcare is built on consolidation and negotiated monopolies. Markets require voluntary exchange. People that enter the system in fear, pain, or confusion, under duress. Markets require that consumers can walk away. Patients cannot. These aren't minor deviations. They are fatal contradictions. Yet our national dialogue is still built on this false premise. We keep trying to fix healthcare as though it were a misfiring market rather than naming it for what it is, a highly regulated, privately intermediated, administratively inflated, institution-centered payment system masquerading as a market. What we actually have is a billing infrastructure, not a care infrastructure, not a health infrastructure. An elaborate maze of proprietary code sets owned by private entities, valuation committees shielded from public governance, pricing algorithms that shift by payer and by contract, data systems designed around reimbursement, not outcomes, and legacy incentives that reward downstream rescue while starving upstream prevention. 50 different healthcare systems, one for every state. This architecture rewards crisis over continuity, documentation over dialogue, effort over effect, volume over value. It rewards the appearance of complexity rather than the achievement of medical clarity. And anything that threatens this architecture, anything that reduces complications, shortens hospitalizations, eliminates avoidable utilization, or shifts care upstream is punished economically, not metaphorically, literally. Healthcare in America is not failing because Americans are non-compliant or physicians are burned out. It is failing because its foundation is misaligned with the purpose of medicine. The system cannot deliver health because it was never designed to deliver health. It can only deliver transactions, wrapped in the language of markets, to reassure us that something rational is happening beneath the surface. But the surface is the misdirection. The mechanics underneath are the truth. A system cannot see value, cannot reward value. And a system that cannot reward value will never evolve towards health. Over the next 9 days, this series will walk through the machinery beneath American healthcare. RVUs, CPTs, the RUC, ICD-10, halted innovation, physician burnout, and the incentives that produce predictable dysfunction. This is not a story about brokenness. It's a story about design. Then we will spend the next period of time talking about how to solve this conundrum for good. Today, we begin by naming the truth the industry avoids. Healthcare in the United States is not a market. It's a shell game. And a shell game cannot be fixed. It must be rebuilt. Tomorrow, how doctors really get paid, the currency that distorts American medicine. Thank you for listening. I look forward to visiting with you tomorrow.